Okay, hello everyone and welcome to our new topic. Today, as you can see, I'm gonna talk to you a little bit about liposoluble vitamins. So actually, for all those of you who have already listened about the story on vitamins and water-soluble vitamins, you know that those are essential organic molecules which are absolutely necessary for the proper maintenance of our body functions. We also said that vitamins are classified into two large groups: water-soluble vitamins and vitamins soluble in fats or liposoluble vitamins. Previously, you have probably studied about water-soluble vitamins, which are vitamins belonging to the B group of vitamins and vitamin C. But in the group of liposoluble vitamins, 4 vitamins are found: A, D, E, and K. And this is gonna be our today's topic. And like you're already almost used to, usually I start my lectures with giving some kind of a general overview about the basic information regarding the topic. And in this case, since we have like 4 vitamins, I'm gonna give you an overview about some of the general common characteristics of those vitamins, and then we're gonna go with a story about one after another vitamins. So let's start with the overview. So we can say that liposoluble vitamins are definitely non-polar molecules, which are all of them hydrophobic derivatives of isoprene molecule or isoprene unit. So we can consider vitamins as polymers of isoprenoid units, like we had the similar situation with the molecule of cholesterol when we discussed about lipid molecules. Cholesterol is also the polymer of isoprene units, and liposoluble vitamins are of the similar structure. Regarding the fact that they are non-polar compounds and that they are derivatives of isoprene, the next general information about those vitamins is that they are insoluble in water, but they are soluble in fats and other non-polar solvents. So, speaking of their non-polar nature, we can connect the possibility of absorption from the dietary sources with the absorption of lipid molecules. So actually, you have studied before that lipid molecules had to be digested in order to be absorbed from gastrointestinal tract. Regarding liposoluble vitamins, not all of them are being degraded in our gastrointestinal tract. Only some of them, if they are found in the form of esters with some fatty acids or some other organic or inorganic acid. In that case, we have to have an enzyme to hydrolyze those esters. But otherwise, liposoluble vitamins are small organic molecules, so they do not need to undergo further hydrolysis into more simple compounds. So they can be absorbed from the small intestine. But for that absorption, they require the action of bile salts in the way we require them for the absorption of lipid molecules. Because liposoluble vitamins are not soluble in water, and if you remember, we have that water protective layer from the luminal side of enterocytes, so we definitely need to overcome that obstacle, and that is going to be in the way that proteins of lipid digestion together with liposoluble vitamins are going to be incorporated in the forms of micelles together with bile salts, forming much more soluble particles which can be readily absorbed from the GIT. The next information is common for all lipid molecules and all liposoluble vitamins as well, that once they are absorbed to enterocytes, they can be reesterified if necessary, and they can be incorporated in the form of chylomicrons, lipoprotein particles, which role is the transport of those dietary lipid compounds and liposoluble vitamins from enterocytes to the liver, where they are deposited in the form of storage units. After that, they can be exported to systemic circulation, and they can be transported to target tissues and target cells in the forms of specialized lipoprotein particles, like we had with the story on lipid molecules and lipid metabolism as well. Regarding the fact that they are not soluble in water, one other conclusion arises, and that is that they cannot be excreted in urine like water-soluble vitamins, so like vitamin C and vitamins from the B complex. So the only possibility of urinal excretion of those vitamins is to be metabolized to some hydrosoluble derivatives. For example, vitamin K can be metabolized into a metabolite which is soluble in water and thus excreted in urine, but others cannot. So in this case, with liposoluble vitamins, we have something that we haven't had with the water-soluble vitamins, and that is the situation of overdosage with liposoluble vitamins, thus exhibiting possible symptoms of hypervitaminosis. So what about the chemical structure of vitamin A, which is going to be our first vitamin to be discussed? The synonym for vitamin A is retinol, and we can say a few words about the chemical structure. Following the general information, vitamin A is also isoprene derivative, and we have one part of a very special structure in the vitamin A, which is a cyclic part of the structure, a six-membered ring, which is marked as beta-ion ring, and one isoprenoid chain containing 9 carbon atoms, which is attached to that beta-ion ring. And there are actually 2 active forms of vitamin A1 and vitamin A2. And now I'm going to swipe quickly through this slide so I can get you to the figures, so we can discuss a little bit more and a little bit more illustrative about the structure of vitamin A and the forms of vitamin A. So let's get back to this figure. So here we have beta-ion ring with certain substituents in the form of methyl groups, and we have a very specific double bond between C5 and C6. And we have OH group at the end of isoprenoid chain. So we have a hydroxyl group, and it is an alcohol form of vitamin A, and that is the reason why we have the suffix OL in the end. So it's retinol or vitamin A1. We have vitamin A2 as well, the second form of vitamin A, which is 3-dehydroretinol. The difference is that we have one more additional bond between C3 and C4, and also we have OH group in the end of the isoprenoid chain. Also, what we have here, the third structure actually represents the possibility that the alcoholic OH group can be oxidized to aldehyde group. So retinol is transformed to retinal, its aldehyde form. And furthermore, if you recall your basic knowledge from organic chemistry, aldehyde group can be also oxidized into carboxyl group, and we have the final form of the vitamin A, which is retinoic acid. Also, when found in the form of retinol, in the form of alcohol, vitamin A can be subjected to esterification with certain acids. So those can be fatty acids like palmitic acid, or those can be some organic acid like acetic acid, or phosphoric acid, or some other acids, thus forming the group of derivatives of vitamin A marked as retinoids. In our body, in our human organism, all vitamin A molecules and double bonds which are found in vitamin A molecule are of trans configuration, as you can see here from the figure. But in retina, we have the transformation and conversion of trans form of some of those double bonds into cis form. So we get 11 cis retinal, which is for, and 11 cis retinol, which are found in retina. And those cis isomers are extremely important for the proper function of eye and the proper process of eye vision. Also, those vitamins A's which structures are represented in the figure can be synthesized, can be obtained by chemical modification of so-called provitamins A, which are also marked as carotenes. Some of the structure of basic types of carotenes are represented in the figure below. So we have three major types of carotenes, which are alpha carotene, beta carotene, and gamma carotene. So if you take a look at the structure of those carotenes or provitamins A, we can see that they also have ion rings and 18 carbon atom isoprenoid chain between them. So by breaking or by cleavage of those middle double bond, we can get active vitamin A. So from beta carotene, we can get 2 molecules of vitamin A, but from the alpha and gamma carotenes, we can get only 1 molecule of vitamin A due to the fact that those ion rings at the second part of the structure, at the very right end of the structure, are not those which are required for the structure of vitamin A. And this is shortly summarized in the slide in the form of words and in the form of text. So let's move on. So which are the rich dietary sources of vitamin A? So like most of the liposoluble vitamins, major sources, dietary sources of vitamin A are of animal origin. And those are fish oils from sea fish, or also from cold sea fish, animal liver, egg yolk, milk and dairy products like cheese, butter, kaimak in our region, and so on and so on. Provitamins A can be found in dietary sources of plant origin in some vegetables and some fruits, and those are predominantly fruits and vegetables which are rich in those yellow reddish pigments, carotenes or provitamins A, like carrot or lycopene from tomato, apricot, and similar sources. What is the metabolism, common metabolism of vitamin A? So it follows the pattern which we indicated from the general overview. So when it enters the human organism through dietary sources, food actually contains predominantly ester forms of vitamin A. So actually those esters of vitamin A have to be subjected to the hydrolytic action of pancreatic hydrolases, which are going to hydrolyze those ester bonds and release the vitamin A in its original form. Then it's absorbed by together with other lipid digestive products in the form of micelles formed with bile salts. And in enterocytes, if necessary, reesterification occurs and vitamin A is incorporated in the form of chylomicrons. It enters the portal bloodstream and it's transported to the liver. In the liver, further chemical modification of vitamin A occurs, and in that form, 3 enzymes are important for us. First, provitamin A has to be significantly chemically modified to become an active vitamin A, and that is achieved by one enzyme belonging to the group of monooxygenases, and this one is called carotenase. So in the presence of molecular oxygen, carotene is converted to retinol. And I'm going to show you this figure, which is more illustrative than words. So beta carotene from fruits and vegetables is subjected to the cleavage of the central double bond by one of the enzymes from the group of monooxygenases in humans, which is called carotinase, in the presence of molecular oxygen, and we get 2 molecules of all-trans retinol. This retinol can be further reduced by a specific NADPH-dependent retinol reductase into active vitamin A or retinol. Story is much more simple with vitamin A from animal dietary sources. So vitamins A, if found in the form of esters from meat, fish and eggs, is subjected to hydrolysis with specific hydrolases to form vitamin A. Vitamin A or retinol can be further subjected to retinol dehydrogenase or specific oxidases to form all-trans retinol or retinoic acid. Vitamin A, when secreted to bloodstream, is incorporated in the form of lipoprotein particles, and actually it is attached by a specific retinol binding proteins and thus transported through our body. So this is summarized in the text in the slide, which you can see right now. But moving on further to biochemical importance of vitamin A, we can say that all 3 forms of vitamin A, retinol, retinal, and retinoic acids are biologically active. And I think that the very first function that comes to one's mind is that vitamin A is important for the proper maintenance of the retina function. But apart from this, vitamin A is involved in numerous other biological functions. So vitamin A is important and necessary for the proper growth and cell differentiation of numerous tissues, like you see here from the slide. It has a beneficial and positive effect on juvenile organisms' growth, on development of embryons, spermatogenesis, epithelialization, and proper secretion of mucus. Also, vitamin A is actively involved in the maintenance of the proper immune response. And also certain papers and research results suggest that vitamin A might exhibit certain anti-carcinogenic activity and many others. I'm going to illustrate just one important function regarding vitamin A, and that is the eye vision process and involvement of retinol in the eye vision process. So having that in mind, I'm going to represent you here one figure and one scheme describing us the visual cycle, and a lot of details about this visual cycle will be delivered to you in the biochemistry of an eye. So for those people who are not having that separate lecture, this is just in short. So the crucial role in the visual cycle is dedicated to the one pigment which is marked as rhodopsin, which is found in retinal rods. And what happens here, so from blood circulation, if you can follow the figure, transretinol is converted to cis-retinol and to cis-retinal, 11 cis-retinol and 11 cis-retinal. And it binds to the protein which is marked with apoopsin. So binding of cis-retinal, so apoopsin forms rhodopsin, and then in rhodopsin, cis-retinal is converted back to 11 transretinal, which causes the degradation of rhodopsin, which actually induces and stimulates the optic nerve and brain vision center, and as a result, we have the visual response of our eye and brain centers. Regeneration of this cycle and regeneration of this pigment occurs in the dark. So what happens if we are having and facing vitamin A deficiency. So vitamin A deficiency may occur as a result of inadequate diet. So if you're not taking food which is rich in vitamin A, and those are predominantly products of animal origin, you may find it difficult to achieve the physiological levels of vitamin A in the body. Also, some malabsorptions can lead to vitamin A deficiency, thus preventing the proper and adequate and sufficient absorption of vitamin A from GIT. Also, as you remembered, we mentioned previously that the significant portion of chemical transformations of vitamin A occurs in the liver. We can conclude that certain malfunctioning of liver, like in cirrhosis and in persons with alcoholism, actually may lead to improper transformation or bioactivation of vitamin A from provitamins, which actually yields the vitamin A deficiency in the end. Which are the symptoms of vitamin A deficiency? So vitamin A deficiency predominantly affect those tissues and organs which actually require vitamin A for their proper function. So we mentioned skin. So skin is affected, and some kind of hyperkeratinosis and increased keratinization is observed in patients with vitamin A deficiency. Also, epithelium is affected. So desquamation of epithelium occurs. So it actually may be subjected to infection more easily than in normal cases. So we have the increased potential risk for infection development. Of course, eyes are affected by vitamin A deficiency. So we have a development of so-called night blindness or nyctalopia, and changes in conjunctiva and cornea, susceptibility to infections, and finally, in the most extreme cases, it may lead to complete blindness. It is also believed and suggested that vitamin A deficiency is responsible for as a potential cause of sterility, teratogenesis, carcinogenesis, and numerous others. In infants, it affects bone and teeth growth and yields to numerous disorders of those. But also hypervitaminosis of vitamin A may occur, thus exhibiting certain toxic symptoms. Usually, intoxication with vitamin A occurs as a result of overdosage with supplements, dietary supplements. Rarely, it is the result of the dietary overintake of vitamin A. So, acute intoxication with vitamin A exhibits some general symptoms of acute intoxication, like fatigue, like dizziness, headache, vomiting, skin desquamation, and so on. But also, if prolonged, hypervitaminosis of vitamin A may lead to a number of symptoms of chronic intoxication, like problems with skin itching, dermatitis, irregular hair growth with the development of alopecia, fissure on lips, painful and sensitive bones, headaches, anorexia, irritability, fragile nails, and numerous other symptoms. Some of those are general symptoms of chronic intoxication with numerous compounds, but some of those are pretty specific. And one more symptom of hypervitaminosis is the yellow coloration of the skin called hyperkeratonemia. Daily needs for vitamin A differs for females and males and ranges from 800 to 1000 micrograms a day. And of course, those daily requirements are increased during pregnancy and lactation. Usually supplements of vitamin A are used to stimulate growth of a juvenile organism and development in infants. You know, if you remember, you took at the time when you were children, you took those AD drops. At least it's in our country. So it's also used for regenerative processes. It's used as a prophylaxis of sterility and infections, and so on. Treatment of some skin problems and skin diseases, and so on and so on. Usually the physiological levels of vitamin A in blood ranges from 0.3 to 0.65 milligrams per liter. And those would be the general information about vitamin A and its importance for us. Of course, this is, just the top of the iceberg, and there is much more. And honestly, I could talk about vitamin A and all other liposoluble vitamins like hours and hours. But of course, here we are to give just a brief overview on the issues. So moving on to vitamin D, its other name is calciferol, and you see the structure of several types of vitamin D. So you notice that we have two types of vitamin D, vitamin D2 and vitamin D3. We also have some precursors or provitamins D like ergosterol and algocalciferol, 7-dehydrocholesterol, which can be the precursor for the additional synthesis of vitamin D when exposed to UV light, and vitamin D3 as cholecalciferol of the animal origin. So you notice that vitamin D actually has a very specific steroid structure, like we had with the molecule of cholesterol. So in the basis of the structure of vitamin D, we have that steron ring, which is the system of 4 condensed rings, 3 6-membered rings, and 1 5-membered ring, and some substituents attached. But we have a lot of similarities with cholesterol. So we have OH group at the position number 3, like cholesterol, and we have a double bond at C5 like in cholesterol. At C10 and C13 we have methyl groups like in the molecule of cholesterol. At C17 we have a hydrocarbon chain like we had with the cholesterol with slight modifications. And in 7-dehydrocholesterol we have one more additional double bond, as you can see from the figure. Vitamin D3, the second 6-membered ring is kind of open in vitamin D as well. So those are just slight chemical modifications, and other parts are pretty similar to the molecule of cholesterol. And let's follow the same and identical pattern that we did for vitamin A previously. So let's name some main dietary sources of vitamin D. And again, as I have already mentioned, animal origin food, it predominates with vitamin D. So fish oil, sardines, egg yolks, liver, butter, milk. So sources which are rich in vitamin A are rich in vitamin D as well, obviously. Vitamin D can be found in some sources of plant origin, like some vegetables like yeast, mushrooms, sweet peas, spinach, cabbage, in the form of ergosterol, but it has to be subjected to chemical modification in our skin by the action of UV light. Also, a lot of authors are proposing the possible biosynthetic pathway of vitamin D, starting from the precursor 7-dehydrocholesterol and its modification by the action of UV light, and further additional modifications at the level of liver and kidneys. But this kind of biosynthetic pathway of vitamin D from 7-dehydrocholesterol is not the pathway which actually is significant, or it occurs in significant intense. So we have to take vitamin D through dietary sources anyway. Speaking about the metabolism, it follows the same pattern. So it's absorbed from small intestine, and it's absorbed together with all other lipids and liposoluble vitamins. It's incorporated in the forms of chylomicrons in enterocytes, and then it's released to portal circulation, transported to liver, and then further on is subjected to certain chemical modifications. So this is a nice figure which I really like, which represents the chemical modifications of vitamin D. So we can have it from activation by the UVB rays from UV light. So provitamins can be converted and activated to vitamin D3, or we can supply our body with vitamin D from the diet. And of course, here in the figure, this is stated limited dietary sources of vitamin D, because honestly, nowadays, generally dietary sources are poorer and poorer with vitamins and minerals and other healthy molecules. Because the soil is poor, we have an enormous usage of fertilizers and insecticides and pesticides in general. So nowadays the food is really poor with those important dietary molecules, and we cannot compare the food that our ancestors took at the time with the food we are taking right now. Food processing also damages the structure of important dietary molecules. So it is not obvious that we have to state that those are limited dietary sources. Fortified milk, nowadays you have numerous products and milk on the market which is fortified, with added vitamin D. Also fortified orange juice, but predominantly in United States. In our country and in our region you won't find it. Salmon and other fatty fish from cold waters is rich in vitamin D, and of course vitamin supplements. Then vitamin D, which is obtained from the diet or obtained by the chemical modification from provitamin D, is transported to liver, and in liver it is subjected to the first huge chemical modification, and that is hydroxylation at the position 25. So we get 25 hydroxy vitamin D or 25 hydroxycholecalciferol. This intermediate is the major storage intermediate in our body, and then it's subsequently converted to 125 dehydroxy vitamin D or 125 dehydroxycholecalciferol in kidneys, and this is actually the active form of vitamin D, which even exhibits certain hormonal function, and it affects intestine and bones in the terms of maintaining the homeostasis of calcium. So it affects intestines, thus increasing calcium and phosphorus absorption, and it affects bones and increase the mobilization of calcium from bone storages. But you're going to have a much more detailed insight in those processes and these conversions from the slide in the chapter on metabolism of calcium and in the chapter on endocrine system, when you're going to discuss about parathyroid hormones and calcitriol, vitamin D hormone, and so on. So there actually it's involved in the maintenance of calcium and phosphorus in our body. But what about biochemical importance of vitamin D? Actually, it continues to this fact. So obviously, it is important for the maintenance of the calcium and phosphorus homeostasis, and it plays the crucial role in the proper mineralization of bones and teeth. Also, like vitamin A, vitamin D is also involved in the cell differentiation, spermatogenesis, ovulation, lactation, and also this information I think is so very well known to most of us these days and these months during the COVID-19 pandemics, and that is the unquestionable role, positive, beneficial role of vitamin D in immunogenesis and in the proper maintenance of our immune system. Target cells to vitamin D are numerous. starting with small intestine for calcium absorption, bones, kidneys, endocrine glands, brain, skin, lymphoid cells. Almost you cannot name a cell which is not affected by vitamin D. Also, like I said previously, vitamin D, when transformed to its 1,25-dehydroxyactive form, exhibits certain hormonal effects, and it affects the maintenance of the levels of calcium and phosphates in blood. It also induces calcium-binding protein synthesis, which is important for the increased absorption of calcium from gastrointestinal tract, and you're going to have a more detailed insight in those mechanisms in the chapter on calcium metabolism and endocrine systems. Vitamin D deficiency can be developed as a result of, again, inadequate diet, like in most of hypovitaminosis and vitamin D deficiencies, or as a result of insufficient exposure to sunlight. And now we're coming to something which might be a little bit controversial, because we are advised for the past decades that sunlight is so harmful and you should avoid exposure to sunlight. And most of the people are using cosmetic preparation with high protection factors against UV rays, both UVA and UVB. But you know, it has some negative and adverse effects, because when using such preparations, and if you're really avoiding the exposure to sun, you're actually disabling your body and your skin to start chemical modifications of provitamins D or activation of vitamin D in skin. And this is probably the reason why most of the nowadays population are facing the hypovitaminosis of vitamin D. So you have to act clever. So absolute avoiding of sun is definitely not good for you. Of course, those traditional touristic exposure to sun from noon till 5 o'clock and then getting back to the hotel and getting ready for the night shift in clubs and restaurants is also not good. But exposing your skin to sun in the morning and in the afternoon is so beneficial and so important for the proper bioactivation of vitamin D. But it's a controversy. Think about it. Also, as a result of poor absorption from GIT due to some inflammatory processes in GIT or some allergies to food and so on, of course, liver and kidney diseases may end up in vitamin D deficiency due to the fact that it's bioactivated and metabolized in both liver and kidneys. Also, it can be the result of an inadequate response to target cells, and some application of certain medicines like anticonvulsives like phenobarbital actually is found to be the molecules which increase the degradation of vitamin D, thus possibly yielding to hypovitaminosis of vitamin D. So what are the consequences? Definitely disturbed absorption and metabolism of calcium and phosphates. And now I'm going to just list some of the major consequences and symptoms of vitamin D deficiency. I'm not going to go into details because you're going to do it in the upcoming chapters on calcium and endocrine system. So it increases the neuromuscular excitability. It increases the secretion of parathormone, which actually also is activated in the response of the low levels of calcium in blood. So this is the same and similar function to those of D hormone, but in the cases of vitamin D deficiency, PTH secretion increases. And also something which is probably the most famous consequence of vitamin D deficiency is disturbed mineralization of bones and teeth, yielding the formation of numerous deformities of bones like rickets in children, like osteomalacia, osteoporosis in adults, and so on and so on. Speaking about hypervitaminosis, again, the acute intoxication with vitamin D may yield the formation of weakness, nausea, vomiting, diarrhea, headache. So those are kind of, again, common symptoms of acute intoxication. But also it may cause the renal function disorders like polyuria, proteinuria, and so on, and precipitation of calcium in soft tissues, causing nephrocalcinosis, atherosclerosis, aorta stenosis, calcifications in heart, lungs, skins, and so on. Daily needs for vitamin D do not exceed 10 micrograms per day, but of course those needs are increased during pregnancy and lactation, during the growth of juvenile organisms, and of course as a prophylaxis and therapy of rickets, osteomalacia, osteoporosis, of course if the patient developed hypovitaminosis, in hypoparathyroidism treatment. And some of the novel results of the research suggest that vitamin D can be also used as the treatment of some skin disorders and diseases like psoriasis, in the treatment of some diseases of hematopoietic system and some malignant diseases. But one has to be very careful here and not taking vitamin D without the consultation with a medical professional, definitely, to see first the levels of vitamin D in blood, whether there is hypovitaminosis of vitamin D, and then to set the proper dosage of vitamin D with which can be provided by taking vitamin D supplementation. So it's not my recommendation to take vitamin D supplements on your own. Now it's so popular and everyone is talking about vitamin D supplements in the era of COVID-19 pandemics. But again, I'm emphasizing the fact that one has to be very careful when dealing with liposoluble vitamin, because intoxication with these vitamins and hypervitaminosis may end up in numerous adverse and negative effects. So one has to be careful. Moving on to the next vitamin, it's vitamin K, or anti-hemorrhagic vitamin. The chemical structure of this vitamin is shown in the figure here. So it has a very specific system of 2 condensed rings, and we have one methyl group and we have 1,4-naphthoquinone ring, which is actually bound to isoprenoid side chain. And like you see from the figure, we have 3 types of vitamin Ks. Vitamin K1 is marked as phyloquinone. It's mainly of the plant origin. Vitamin K2 is marked as menaquinone, which is produced by our intestinal bacteria. Plants, not that much. And it's an active form of vitamin K for our body. And vitamin K3, menadione, is definitely synthetic vitamin K. Which are the dietary sources of vitamin K? Those are predominantly fresh green plants like cabbage, spinach, salad, kale, and so on, if you like them. I adore spinach, but I don't like kale, definitely. But anyway, food from animal origin to a lesser extent, like liver and milk. But what is very important and characteristic here is that our intestinal bacteria are actually synthesizing approximately half of the necessary amount of vitamin K for the proper functioning of our body. So metabolism of vitamin K is pretty similar to those for liposoluble vitamin. So it's absorbed by micelles and bile salts in the form of micelles, or some of the hydrosoluble formulations can be absorbed directly to blood circulation. And of course, they are transported through body in the form of different lipoprotein particles like chylomicrons and VLDLs and so on. The storage site of vitamin K is liver, and it can be metabolized or biotransformed in the liver to some more polar forms, which can be further excreted in bile or in urine. Vitamin K is important biochemically for the maintenance of proper function of our organism, and the most important function of vitamin K it's its function in blood coagulation, because actually vitamin K is required for the proper biosynthesis of numerous coagulation factors 2, 7, 9 and 10 in the liver. And also it is required for the biosynthesis of other vitamin K dependent proteins. Daily needs ranges from 1 to 2 milligrams a day, and of course, like I have already mentioned a couple of times, daily needs are increased during pregnancy and lactation. So vitamin K deficiency is pretty rare in adults, but in newborns it can be developed due to the insufficient development of intestinal bacteria. Thus that portion from like 50% cannot be achieved in newborns, so they can exhibit certain mild vitamin K deficiencies. Also, hepatobiliary system disorders may end up in vitamin K deficiency, and of course, like you can assume, even without me, the prolonged usage of antibiotics severely disturbs our intestinal bacterial flora, so vitamin K deficiency may occur in patients using the prolonged therapy with antibiotics. Also, some liver diseases can end up in vitamin K deficiency because vitamin K cannot be converted to its active form metaquinone at the level of liver. And of course, the application of certain medicines like anticoagulants can decrease the levels of vitamin K in blood, developing symptoms like hemorrhagic diathesis and increased tendency to bleeding, and prothrombin time is increased 2 to 3-fold in these cases. Moving on to vitamin E, almost approaching the end, so the last but not the least, vitamin E or tocopherol is also known by its name anti-sterility vitamin. It has a very typical structure, which I'm gonna show you on the slide which follows this one. So it actually, vitamin E is considered to be a group of methylated derivatives of aromatic alcohols, tocol or tocotrienol. And actually there are 4 types of tocopherols: alpha, beta, gamma and delta tocopherols. But biologically important is only alpha tocopherol, and I'm gonna just swipe quickly through this slide to lead you to this slide representing different types of tocopherols or tocotrienols. So you see that we have an aromatic alcohol tocopherol, which is methylated at certain points, and again you have an isoprenoid chain or unsaturated or saturated phenyl chain forming different types of tocopherol, but only this first type, alpha tocopherol, is biologically active, and we're focusing on its properties and biological function. So sources which are rich in vitamin E are definitely this time synthesized only by green plants. So plant oils are rich in vitamin E, like soy oil, sunflower, corn oil, peanut oil, and so on. And also vitamin A is found in fruits, vegetables, and to a much lesser extent in meat and milk and other dietary sources of animal origin. Metabolism of vitamin E actually completely follows the pattern which we have already emphasized with liposoluble vitamins in general. So biochemical importance of vitamin E is actually based on its antioxidant activities. So vitamin E is found to inhibit the lipid peroxidation of membrane lipids, thus protecting the cell from the degradation of membrane, which has an absolute consequence in numerous pathological processes and development of diseases. Also, it is believed that vitamin E increases the biological activity of vitamin A and carotenes. Also, it affects the energy metabolism and it stimulates the action of coenzyme Q and increases the coenzyme Q levels. And also, like other liposoluble vitamins A and D, it's involved in the maintenance of our immune response, thus elevating T lymphocytes levels in our body. Also, it affects the activity of our sympathetic nervous system. And what is important, it is also found that vitamin E inhibits the thrombocyte aggregation, and due to this property, it was believed at the time that the prophylactic usage of vitamin E in a higher amounts, in higher concentration and dosages, may act protectively for heart and blood vessels, thus preventing cardiovascular diseases, myocardial infarctions, cerebrovascular infarctions, and so on. But after a few years of taking vitamin E, large amounts of vitamin E and vitamin C for a prolonged period of time, that was done with the patients in United States predominantly. It was found that there is statistically significant increase of sudden deaths in those patients. So United States FDA, Food and Drug Agency, actually stopped and forbid the usage of vitamin A for such purposes because it was used in enormous large amounts, which obviously exhibit some adverse or negative effects to health. Also, it is found in some research papers that vitamin E inhibits chemically induced carcinomas in experimental animals, and it is found and it is believed that it affects fertility and that it is important for the proper maintenance of the sexual function. Daily needs do not increase 10 milligrams, a little bit less for females, so 8 to 10 milligrams. And vitamin E deficiency is very rare, so it is described only in experimental animals, like the development of anemia, sterility, atrophy of testes, miscarriage, muscle dystrophy, and so on. It's not described in humans so far. And finally, to conclude this topic, I'm gonna close it with vitamin F. So if you ask now what is vitamin F, so according to some authors, essential fatty acids are believed to be vitamin F. So you know the structure of essential fatty acids, so they are polyunsaturated essential fatty acids which we cannot synthesize, like linoleic, linolenic, and arachidonic acid, which is, which is considered to be both essential and non-essential because it can be synthesized in our body from linoleate, but actually linoleate is essential fatty acid, so it can be considered essential fatty acid as well. Sources of vitamin F or essential fatty acids are definitely plant oils, soy oil, sunflower oil, peanuts oil, and metabolism is actually the same as the metabolism of other lipid molecules, so absorption by bile, incorporation in chylomicrons, transport in the form of VLDL, LDL, and so on and so on. What is the biochemical importance of essential fatty acids? So they are involved in the growth and reproduction, they are involved in the regeneration of skin epithelium, and they exhibit numerous regulatory function. Let me just remind you that in our phospholipids, in our membrane phospholipids, at the position number 2, we have the arachidonic acid predominantly found, and arachidonic acid is the major precursor for the biosynthesis of eicosanoids, prostaglandins, thromboxans, and leukotrienes, which is going to be our separate topic in a while. And they're molecules which exhibit very important and crucial and essential regulatory function, and they are regulating our immune response, our inflammatory response to inflammation, to infections, to injuries, and so on and so on. Daily needs for fatty acids is approximately 5 grams. And vitamin F deficiency rarely occurs because we are taking all those plant oils regularly in diet. But in cases of vitamin F deficiency, hyperkeratosis occurs or skin lesions. But increased intake of essential fatty acid is believed to exhibit a decreased risk for heart thrombosis and heart diseases and cardiovascular diseases. So it is believed that omega-3 and omega-6 fatty acids can be used as prophylaxis of atherosclerosis. But of course, more about these in the chapter on arachidonic acid and all those eicosanoid molecules later on. So for now, that would be, people, girls and boys, all that I wanted to tell you about liposoluble vitamins. I hope you like the topic, and I hope that we see each other pretty soon with the new topic to come. So stay healthy, stay safe, and I hope to see you soon. Bye bye.